Hey guys, this is Michelle from Virtual Hand Care, and in this video, I'm gonna show you how to apply a finger bandage by yourself. So yesterday, my puppy bit me. And yes, this sweet looking puppy did this. So I don't wanna go into a ton of details about how it happened. Some of it was my fault, some of it's her fault. If we ever get in that situation again or a similar situation, I'm going to definitely do things differently, and I'm also going to seek out a professional dog trainer to hopefully prevent any kind of potentially more severe injuries down the road. This happened yesterday, actually not even 24 hours ago, so I'm going to go ahead and take my dressings off, show you guys what my wound looks like. So if you're not really into that kind of thing, you may just want to skip this video if you don't want to see a little bit of blood and skin. But if you want to see what this looks like, then let's get started. So the first important tip that I want to give you when you are doing your own dressing changes is to make sure you have all of your dressing materials, your non-stick dressings, your gauze, your tape, gloves, scissors, whatever it is that you need for your dressings. You want to make sure you have all of that prepped and ready to go before you start removing your dressings, because you don't want to have that open wound and then you're trying to fumble around with packaging and things like that. So I've already prepped a glass of 50% hydrogen peroxide and 50% water. I have this prepped and ready so that I can submerge my finger in it in case I have a little bit of a sticky bandage, but also to help clean that wound. Now, depending on what your doctor wants you to do, some doctors don't want you to use full strength hydrogen peroxide or bacitracin. For one, they don't want your wound to get too wet, which leads to maceration, which can make it not heal together. But also a lot of those products can be what's called cytotoxic, which means it can have an effect on even healthy tissue and healthy growth, which you definitely don't want to disrupt that. Because it is a dog bite, I do want to make sure that my wound is nice and clean as well. And also I want to make sure that my dressings do not stick to my wound and then potentially pull off any nice healthy tissue as well. With that said, let's go ahead and start taking off this dressing. So as you can see here, I used 1-inch gauze wrap, and we will also be reapplying with 1-inch gauze wrap, and I'll show you that when we reapply the dressings. So I have a Telfa non-adherent pad, but sometimes depending on how much you do drain, sometimes they can stick a little bit. And I feel like mine is sticking a little bit too much. It's not gonna fall off. So I'm gonna go ahead and soak my finger in this 50-50 just to get that a little wet so that it can come off a lot easier. So you can really spend a couple of minutes just kind of soaking that finger just to let those dressings just kind of fall off. So you really don't have to really pull on them too much. Depending on how long between your dressing changes, sometimes it can stick quite a bit. So really it is important to at least try to do daily dressing changes. And if you have a wound that is seeping a lot, then you'll want to do dressing changes 2 to 3 times a day until the drainage starts slowing down. All right, as you can see, it's been a few minutes and this dressing is finally starting to kind of come off, which is nice. And I don't even really need to pull it off. Excellent, good. So you will want to dump this out because it's contaminated. So you'll want to make sure you use new water, new hydrogen peroxide, or just water the next time you have a dressing change. Now I did apply a steri strip because there was a pretty good gash right in here and I kept feeling like the skin was pulling. So that steri strip actually is helping hold my skin closed. And it's still sticking pretty good, so I'm not really going to bother with that steri strip. I'm gonna just let it stay on until it starts coming off. After you've taken all your dressings off, you want to give yourself a good 10, 15, maybe 20 minutes of nothing on your wound so that you can let your skin breathe a little bit. Let that wound get just a little bit of air to it so that it doesn't constantly stay moist, constantly stay covered. The length of time that you do keep all the dressings off will depend on how macerated or how white, wrinkly that skin looks. So you definitely want to adjust that depending on your wound. So mine isn't too bad, but because I've had my dressing on for almost a whole 24 hours, I'm gonna give myself a good 10 minutes here just to let everything dry off before I reapply my dressings. Okay, so it's been about 15 to 20 minutes. I went ahead and gave myself a little more time to let my finger air out. The next step would be to assess your particular wound. If your skin is completely healed and you have no drainage, then you could maybe just apply a Band-Aid or maybe just a light gauze, and you don't necessarily need a barrier between your wound and applying gauze or Band-Aid. Now for me though, because it's been less than 24 hours, I do still have some seepage happening. I do still have some drainage. So I'm going to apply a little bit of a barrier. There are several different types of barrier dressings. There are petroleum-based type of dressings such as Zero Form. There is also Adaptic. Those have a little more moisture to them, which can be beneficial for wounds that are seeping quite a bit. If you just had surgery, having that nice barrier over the wound and then applying the gauze will help the gauze not stick to your incision, which for one thing will help it not be as painful when you remove it, but will also not pull off that new healthy tissue that's trying to grow. So for me though, I'm gonna go ahead and apply a little piece of Telfa that I pre-cut, and I went ahead and cut a long piece rather than just something small. I find that if you can go the whole length of the finger, that can help your bandage stay on and prevent it from slipping around too much. And then I also find very, very helpful is 1-inch gauze. Using 2-inch is very thick, so really do make sure you get 1-inch gauze when you are wrapping the finger. So what I'm doing is I'm gonna place the gauze this way so I can easily unroll it. And I'm using my thumb to help hold that first piece down. And I'm just gonna go ahead and lightly wrap around. And I'm just overlapping that gauze halfway on itself here. And I'm just gonna wrap all the way down, and I'm not pulling, I'm not making it too tight at all either. Good, and so I could then, you can come back up just a little bit if you wanted to make that just a little bit thicker right there, but you definitely want to use the minimal amount that you need. So then I would go ahead and cut that. And then you want to apply a little piece of medical tape to let that gauze stay put. Okay, and then to top all that off, you can apply some Surgitube if you have it. I do find applying Surgitube can help just kind of hold everything together. It just helps cover things a little bit more. Now, there are applicators that you can purchase to apply the Surgitube that can be helpful if you're very tender and you can't really take any kind of pressure on your finger. You can also kind of make your own. I've seen people use medicine bottles and put the Surgitube on their pill bottles and apply it that way as well. It depends on the bottle that you have. Mine has this little notch right here that would not work very well. So if you don't have anything like that, you could use that. Any kind of a smaller type of tube that you could fit your stockinette over actually can help as an applicator. Now, another tip without any kind of applicator is to just stretch out that Surgitube. And this is helpful if you can pre-cut it, if you know the length that you typically need. You can just kind of lightly stretch it out. Just don't overstretch it because it can get really loose and you really can overstretch it. I'm gonna go ahead and just lightly stretch mine out. And then I'm gonna go ahead and roll it a little bit. and place it on my finger to where it's comfortable. And I'm gonna go ahead and just unroll it onto my finger. That way I didn't have to apply a lot of pressure. Now, you could just cut this excess if you want, or what I like to do just to kind of finish it off and to apply a little more protection to the tip of the finger if you need it, is to just do a little bit of a twist with the Surgitube. Hold it with your thumb, open that up with your other fingers, and then just kind of lightly pull that over your finger. Then you have a little more protection at the tip of the finger. And as you can see, you have a pretty slender kind of wrap. It's not something so bulky pushing on the other fingers. You should still be able to gently move through it if you're able to. Now, if you found this video helpful, do please give it a like and hit that subscribe button below. And if your finger is healed, your wound is healed, and you're ready to start moving, then check out these videos here where I have finger exercises to help you get your range of motion back. Thanks for watching.